Imagine your body not being able to regulate the amount of sugar in your blood. Sounds scary, right? This is the reality for millions of people living with diabetes mellitus. Picture this. You're at a dinner party, and there's a buffet of mouth-watering dishes. You're excited about digging into the chocolate cake, but then you remember your body can't handle that much sugar. This is not some macabre tale from a dystopian novel. It's a daily hurdle for those grappling with diabetes mellitus. But what is this condition that seems to be almost as common as the cold, yet far more insidious? It's not just about avoiding sugar or taking insulin shots. It's a complex disorder that affects the body's ability to process blood glucose, commonly known as blood sugar. So, how does this happen? What causes diabetes mellitus? And how can it be managed? Let's delve deeper. Diabetes mellitus, often simply referred to as diabetes, is a group of metabolic disorders characterized by high blood sugar levels over a prolonged period. To truly grasp the essence of this condition, let's take a brief foray into the world of human metabolism. In the simplest terms, metabolism refers to how your body uses food for energy and growth. The food you eat is broken down into glucose, a form of sugar, which is then used by your cells for energy. But here's the catch. Glucose can't enter the cells on its own. It needs a key, and that key is a hormone called insulin, produced by your pancreas. Now, imagine a scenario where you have plenty of glucose, but no insulin. Without the key, glucose can't enter the cells. It's like having a car full of fuel but no key to start it. This results in high blood sugar levels, a condition known as hyperglycemia, which is the hallmark of diabetes mellitus. But that's not the only scenario. Sometimes your body might produce insulin, but the cells become resistant to its effects. It's as if the key is there, but the lock is jammed. This situation is also a pathway to diabetes mellitus. In both cases, whether it's the lack of insulin or resistance to it, glucose builds up in the bloodstream instead of being used by cells. This buildup can lead to serious health problems over time, affecting the heart, kidneys, eyes, and nerves. So, in essence, diabetes mellitus is a metabolic disorder that disrupts the balance of glucose and insulin in your body. It's a condition that demands constant management, as uncontrolled blood sugar levels can lead to a host of complications. Now that we have a basic understanding of what diabetes mellitus is, let's explore the causes. There's not one single cause for diabetes mellitus. It's often a combination of factors that increases an individual's risk. Now, let's delve into the various causes of diabetes mellitus. These causes can be broadly categorized into three: genetics, lifestyle factors, and certain medical conditions. Firstly, genetics. If your immediate family member, like a parent or sibling, has diabetes, you're more likely to develop the condition. This is because certain traits that can cause diabetes are passed down through our genes. But remember, just because your family has a history of diabetes doesn't mean you'll get it. It merely increases your risk. Next, we have lifestyle factors. Unhealthy eating habits, lack of physical activity, and obesity are significant contributors. A diet high in fats and sugars, combined with a sedentary lifestyle, can lead to weight gain. This excess weight, particularly around the waist, is linked to insulin resistance, a key factor in the development of type 2 diabetes. Smoking and excessive alcohol consumption can also increase the risk. These habits can lead to inflammation and oxidative stress in the body, which can damage the cells that produce insulin. Lastly, certain medical conditions can also lead to diabetes. Conditions like polycystic ovary syndrome, or PCOS, and gestational diabetes in women can increase the risk. Other medical conditions, such as high blood pressure, high cholesterol, and certain autoimmune disorders, can also contribute to the development of diabetes. It's important to note that having any of these risk factors doesn't guarantee you'll develop diabetes. They merely increase the likelihood. And in some cases, people develop diabetes without any of these risk factors present. So, we've seen what can cause diabetes mellitus, but how would someone know if they have it? Let's discuss the symptoms. Diabetes mellitus can be a silent disease, often showing no signs until a person's sugar levels are dangerously high. This stealthy onset can make it challenging to diagnose early. However, there are several symptoms that, when noticed, can prompt one to seek medical advice. One of the most common symptoms is increased thirst, also known as polydipsia. This happens because the high sugar levels in the bloodstream cause fluid to be pulled from the cells, leading to dehydration. As a result, you might find yourself constantly reaching for a glass of water. Hand in hand with increased thirst is frequent urination, or polyuria. When there's too much sugar in the bloodstream, the kidneys work overtime to get rid of it, resulting in more trips to the bathroom. This can be particularly noticeable at night, when you may find yourself waking up multiple times to urinate. Next up is unexplained weight loss. If your body can't effectively use the glucose in your blood for energy, it starts burning fat and muscle for fuel instead. This can lead to a decrease in weight, even if you haven't changed your eating or exercise habits. Fatigue is another symptom that often goes unnoticed. Elevated blood sugar levels can cause you to feel tired and lack energy. This is because your cells aren't getting the glucose they need for energy, leaving you feeling drained. Other symptoms can include blurred vision, slow healing sores, frequent infections, and areas of darkened skin, usually in the armpits and neck. While these symptoms can be indicative of diabetes mellitus, they can also be signs of other health conditions. Therefore, if you're experiencing any of these symptoms, it's essential to consult with a healthcare professional for an accurate diagnosis. Understanding the symptoms of diabetes mellitus is a critical step towards early detection and intervention. This disease can be managed effectively when caught early, before it has a chance to cause serious damage. Knowing these symptoms can help in early detection. But what happens after a diagnosis? Let's discuss the treatment options. While there's currently no cure for diabetes mellitus, it can be managed effectively with the right treatment plan. This is our mantra when it comes to dealing with diabetes mellitus. The treatment options are varied and often tailored to individual needs, but they all revolve around a few key principles. Firstly, diet and lifestyle changes are the cornerstones of diabetes management. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help control blood sugar levels. Regular physical activity also plays a crucial role. It's not about running marathons, but rather incorporating moderate and consistent exercise into your daily routine. But lifestyle changes alone may not be enough. That's where medication comes in. There's a wide range of oral medications that can help the body use insulin more efficiently, slow the digestion of carbohydrates, or stimulate the pancreas to produce more insulin. The choice of medication depends on the type of diabetes, the patient's overall health, and their personal preferences. In some cases, insulin therapy may be needed. This is particularly true for individuals with type 1 diabetes who cannot produce insulin themselves. But it can also be used for those with type 2 diabetes if other treatments aren't effective. Insulin can be injected using a syringe, an insulin pen, or an insulin pump. And the type and dosage of insulin will be determined by the healthcare provider. Finally, regular monitoring of blood sugar levels is crucial. This can be done at home using a blood glucose meter or continuous glucose monitoring system. Regular checkups with your healthcare provider are also important to adjust treatment as necessary and to check for any diabetes-related complications. Managing diabetes mellitus is a lifelong commitment, but with the right approach, individuals can live a healthy and fulfilling life. Remember, every journey begins with a single step. With the right support and treatment plan, diabetes mellitus can be managed effectively, allowing you to live your life to the fullest. Today we've learned a lot about diabetes mellitus. It's a chronic condition marked by high levels of sugar in the blood, a result of the body's inability to produce or use insulin effectively. We've delved into its causes, including genetics, obesity, and lifestyle factors like poor diet and lack of physical activity. We've also explored a variety of symptoms that can act as warning signs. These include increased thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, and slow healing wounds, among others. But there's hope. We've discussed numerous treatment options, from lifestyle changes such as a healthier diet and regular exercise, to medication and insulin therapy. These treatments aim to control blood sugar levels and prevent or manage complications. Remember, early detection is key, and managing diabetes effectively can help prevent complications. Stay informed, stay healthy,